Hello, 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 hello. Good evening, good evening, good evening, fellow friends and loved ones. Yes, it's once again a very great privilege and an honor to you to come to your homes once again. Yes, it's the 14th of March. The second week comes to an end today in the month of March, and we are very grateful for your time and your consistency watching us and listening to us with your questions and your suggestions and your comments. Yes, today is no exception, and we are going to discuss a very important and not quite common but an accidental condition, and I'm sure that we'll have a very great time, a very interesting topic as such. Yes. So we without much we do move on, we zoom into our topic for today. So our topic for today is actually called Colles fracture, or we say broken bone of the wrist, or simply put, broken wrist. Yes, so the topic for today is Colles fracture or broken wrist. Yes, so the outline for today's discussion is a quote, the definition, the clinical or relevant anatomy, the epidemiology, the causes, the signs and symptoms, the characteristics or the clinical presentation of the condition. We're going to look at some classification when you have this condition, the types of the condition, and we're going to talk about the diagnosis, how to diagnose the condition, the differential diagnosis, other conditions that look like this condition, and then we're also going to look at the outcome measures, some material that we use to assess the improvement of this condition, the medical management, the physical therapy management, and then some devices that we use for treating this condition, then other suggested guidelines for this condition, and then finally management of the condition. And then we'll possibly talk about some lifestyle modifications. Okay, so today's condition, as we mentioned earlier on, it's Colles fracture. And before we continue, we're going to look at our short quote for today. It states that the two most powerful warriors are patience and time. The two most powerful warriors are patience and time. So these are all virtues that we need to gear up within ourselves and bring them out. Patience and time, these two virtues are needed. Okay, so we move on to our topic for today. We're talking about Colles fracture or broken wrist. Okay, so what is Colles fracture? So it's actually a form of fracture. So when we say fracture, it means a break in the bone. So if you look at my fingers, as my fingers are moving, my fingers, in my fingers, we have something we call bones, we have ligaments, we have tendons, we have other structures, blood vessels, but these bones are the one that gives shape to our body. And then bones are not movable, they don't move, but they give shape to our body. And then so you have bones at your back and the bone that protect the spinal cord, but they have special bones in your forearm. This is your forearm, this is your arm, this is your arm. When you say this is your arm, and this is your forearm here, and this forearm has two bones. We'll look at some pictures very soon. This forearm has two bones. You can see this pointed region that I'm showing you here has an extension down here into your elbow, and then beside this forearm also has another notch, another spot here. This also has an extension down to your elbow. These two are separated by other structures we call ligaments. We have tendons. Yeah. So this separates these structures from each other. So, and the one that I'm pointing here, we see the one away from the body, it's called the radius. The bone here is called the radius. I'll show you the pictures very soon. And the one here, the one close to your small finger, the bone close to your small finger in your forearm, is called the ulna. The ulna and then the radius. The radius is the one that is close to your thumb. So these two bones are very important for us to turn in and out. So when you're locking your key, I mean your door with your key, yes, you need to open up or turn the keys this way. If these two structures are not so strong or the muscles there are weak, you can't open your door. and it becomes difficult. Yes, so these are some of this is a brief anatomy of the condition. Actually, so when you have a break in the bone of any of the two bones, the ulnar or the radius, or sometimes both, due to a heavy fall on the arm like this. So someone from a higher height falls down this way. If it falls down this way, the arm, the wrist goes up like this and hits the ground like this. The person is likely to injure this part of the bone. This bone can break into two, and the other one too can break into two. So if it goes down like this, this part of the bone can break, this part of the bone can break. So when they divide into two, they cause something we call Colles fracture. When they occur here, we don't say Colles fracture, but when they occur near the wrist, we call it Colles fracture. So that's why we have it as generally called broken wrist. But under normal circumstance, it doesn't. The wrist bones don't break. Okay, so let me just give you a small history of these bones. So the finger bones are called phalanges. The palm bones, they are called metacarpals, and then the wrist bones are called carpal bones. And then the forearm bones, these bones here, there are two. You have the ulnar. So I mentioned the ulnar is actually close to your small finger, and the radius is close to your thumb. Okay, so when these two bones, either of them or both of them break, they cause something we call Colles fracture. Pictures will be shown to you very soon. Okay, so actually it involves an upward movement of the bones. So it results in the bones moving up because of the high impact of the fall on the ground. It causes the ulnar and the radius to move up, and then the small ends that are left that are not broken go down. So some pictures will be shown to you very soon also, and this causes the radius and ulnar to be displaced and broken. And so treatment is started as early as possible. That is, we protect the hands and then allow the bone to heal. We'll be talking about it very soon. And this actually is located near the wrist, as we mentioned earlier on. That is why we call it commonly called broken wrist. This condition called the Colles fracture was named after a very important scientist in the year 1814. I'm sure we were not born by then, not even a clot of blood. Okay, so his name is called Abraham Colles. So his surname was named after when the condition was realized by him. So we call it Colles fracture. But the person who discovered this condition is called Abraham Colles. He was an Irish surgeon, so he was from Ireland. So they are called Irish. Okay, and then he described this condition as a classical deformity, and then he defined this condition before even X-rays were brought into being. So we give him the due respect, Abraham Colles. Thank you very much. Okay, so this actually is caused by a fall, a direct impact of the hand, the wrist on the ground. So if the person falls down this way, the wrist goes up and then the hand goes in, and the amount of pressure will cause the bones that the ulnar and radius to break, and this could result in something called Colles fracture. So we have something called ulnar styloid process and a radius styloid process. So the one close to the thumb is called the tip here is called the radius styloid process, and then the one close to the small finger is called the ulnar styloid processes. And then one thing that we should note about this condition is that it's actually a common condition. Yes, that is when people have accidents, especially motor accidents, they are likely to fall on their hands, and then they are likely to break their bone, that's the wrist bone. So according to a research carried out in the United States of America, it was noted that this was one of the most common conditions in the outpatient department, and also it results in a linear transverse fracture. When we say linear transverse fracture, the fracture occurs along, and then straight. So you have a straight line. So the bone breaks this way, and the bone above the forearm goes up, and then the one below close to the wrist goes down. So this causes the bone to separate from each other. and then we need to stabilize it and then start treatment as early as just after the injury. Okay, so it's noted that the distance between the radius and the ulna, so this is the radius, as we mentioned in there, the radius is close to the thumb, and then the ulna is away, that is close to the small finger. So the distance between the ulna and the radius is about 20 to 35 millimeters, not centimeters, millimeters. So the gap is not so wide, but the gap between these two bones, that is the radius and the ulna, is to allow for turning of the wrist and the forearm. So movement is such that when you are turning your arm this way, one bone goes to lie on each other. That is, so you can see my hand this way. The one close to my thumb, the bone close to my thumb, goes over the one close to the small finger and sits on it. But then there are muscles in between the bones that prevent them from coming close to each other. And so God has made it in such a way that without one of the bones, we can't turn, because then one will not allow to move in each other. So they compensate each other. So we're talking about the anatomy of the bone. We're just talking about it. Actually, mentioned earlier on, the distance between the two bones, the radius and ulna, is 20 to 35 millimeters, and this allows the movement of the bone on over each other, that is turning in and turning out. So it allows full movement of the wrist and then the forearm. There are other structures around the region we call the triangular fibrocartilage. These are all structures that help to prevent the bones from coming together, because when the bones trap each other, they could cause the bones to wear off, and then they could lead to other conditions called osteoarthritis, which we talked about in the previous sessions. We have other structures that we call meniscus also around that structure, around the wrist region, that's the wrist region, and this helps to give the wrist its flexibility and the movement of the wrist up and down. We mentioned about the styloid process, that is the tip here, this is the radial styloid process, then ulnar styloid process, and these actually form a point of insertion for movement of some muscles that turn the wrist or the forearm in and out. We have muscles such as supinator muscles, that is allows the arm to turn this way. We have pronator muscles that allow the muscles to turn this way, and these are all actually scientific related. So we have a bone part, that is in the forearm. We have various regions of the bone. We have the metaphysis and diaphysis, and so these metaphysis are actually at the middle part of the forearm, and this help also to allow bone growth. So as a child, the child has a lot of metaphyseal plates, we call metaphyseal plates, and these allow the bone to grow and become longer. So when you are a child, the edges of the bone are soft, and this allows the bone to grow longer. But as we grow we have the edges of the bone, that is the ends of the bone, becoming harder and very compact, and we call it diaphysis. And this helps us to have a firm grip, and then allows us to carry out our daily activities, carry heavy things very effectively, unlike when we are children that we are not able to carry heavy things. Okay, so we mentioned the diaphysis and then the metaphysis. So it is noted that there are cartilages also around this structure that helps to ensure that we maintain the integrity of the bone. Okay, so we're talking about some of the epidemiology, that is the causes. So it is noted that young adults are most likely to be affected, and then very old people are mostly affected by this condition. Young adults, because they are very active. So let's imagine a motor rider, a 20 or 25-year-old motor rider. He's so active said that he could involve in an accident, or a young adult who is so industrious, he jumps off a high hill or high rise building. He's likely to injure his wrist, so he falls down this way on his wrist and then breaks this part of the bone. So this place separates, and then it results in Colles fracture. The very older people are because their bones are quite brittle, that the bones are very soft, so the least impact on the ground or on an object, it breaks the bone. So the young adults and the very old people are most likely affected by this condition. And also, it's noted that more females are affected by this condition because they are likely to have low amounts of calcium in their bones. Yes, so they are likely to have other conditions such as osteoporosis. That is, the bones become very soft, and so they are not able to perform activities very, very well. So it's noted that in the United States of America and in Northern Europe, yes, most people have these fractures, as we mentioned earlier. Aside the United States of America, the Northern Europe, and these are also as a result of their weather conditions. So it doesn't give them enough amount of sunlight. And one thing that sunlight also is very, very important to strengthen our bones and prevent them from breaking. So very older people are predisposed to this condition called Colles fracture the more, because they have very, very soft bones, and then when they fall, they are likely to injure their forearm, this part, or break them. And then it was noted also that the women above 75 years old are mostly predisposed or have this condition called Colles fracture. And it's also stated that the stable Colles fracture are present with minimal combination. So those fractures that are less severe, they don't have the bones breaking into pieces, but the ones that they're not stable, that is a very high impact ones, they have the bones breaking into pieces, and they are very difficult actually to treat. They're very difficult to treat, and then they have a potential of causing other conditions from happening. From happening, other complications could be a degenerative joint disease. We have porosis, osteopenia, other condition. We also have reflex sympathetic dystrophy. These are other conditions that when you have Colles fracture, yes, you could have, that is broken wrist, you could have in addition to. And so the mostly affected places are the forearm. Yes, forearm. So as I mentioned in osteoporosis, that is broken bone, Colles fracture, that is broken wrist, are mostly related to this condition called osteoporosis, where people have their bones being deficient or less of calcium. Calcium is a very, very important element or substance that strengthens the bones. Yes, so it's very important to note that we have enough calcium. So when you go to a medical doctor and you have this weak bones, he asks you to take a test to check your calcium content. If it's low, you take in more calcium foods, and then even through an X-ray, you can see from the X-ray you can see the bones becoming whitish. But then when the bones don't become whitish and become a little bit blackish, that means that the calcium content is not so high. So immediately the radiographer passes on the information to the doctor, and then you take in more calcium foods. Okay, so for these people who are osteoporotic, that is weak bones, they are predisposed to breaking their bones very, very, very easily. And yes, it is noted that people who are older, as I mentioned earlier on, have this condition. And then mostly impact S2 trauma, that is heavy fall. And then also it could be as a result of engaging in activities that such as football, such as volleyball, the sports, motorcycle, riding bicycle, or fall from a very high height. So when we note, how do you know this condition as Colles fracture or broken wrist? There are some signs and there are some clinical presentation of this condition called Colles fracture. So it's noted that the person has this presentation, so that a dinner fork deformity. So if you look at a fork is like this. When you take a fork, I have a depression here, and then you have something that is going in, like for me to pick the food. So if you look at my hand like this, my hand looks like a fork. So I can like this and picks the food and puts in your mouth. So the person breaks the bone shaped inside, bone shaped upwards, it falls this way, and then the bones closer to the wrist goes down, and then this presentation looks like a dinner fork. So these are very clinical signs that we note for this condition. And then what are some of the signs of this condition? Other signs, there could be wrist pain. a dorsal wrist pain. So you can have pain around this area. So even with the mildest touch or simple touch, the person experiences pain. And then there's initial swelling of the affected part. So you could see that around the wrist region, sometimes can extend into the hands and then the fingers and then the whole forearm. So the whole forearm could swell, and this is very important that we note about this condition. And there could be also increased shift of the bone of the wrist upwards, and then also there could be difficulty in grasp or inability to grasp. So if you ask the person that, oh, hold this thing for me, the person cannot even hold it, so he holds and then he leaves it down because of either pain or muscle weakness. So some of the symptoms include pain. The person experiences pain, numbness in the fingers, in the palm, in the forearm. The person also experiences tenderness and then bruising. That is, you could see some tears or skin tears around the region of the forearm, around the side. There could be skin tears because of the impact on the ground. There could also deformity of the wrist. The wrist could deform and change the shape as compared to the other side. This condition can affect both wrists or one of the wrists depending on the direction and the impact of the fall. We have 8 classifications of this condition, but in all there are 4 major types. So we have type 1 to type 8. Type 1 could be transverse metaphyseal fracture. That is, the fracture occurs along the forearm, and the forearm, both the radial bone and the ulnar bone breaks along. We have the type 2 where we have both, including the distal, the ulnar styloid process. So we could have this region of the bone also breaking. We have type 3 where we have this break in the bone, the carpal bones, types of the fracture bones. We're looking at some pictures very soon. And then we also go into how do you diagnose this condition. So I was saying that, how do you diagnose this condition? We could use an X-ray, as we mentioned earlier. So the radiographer takes a picture posterior anterior. So the X-ray is taken from this angle and from the back and also from the side. And this helps to see the type of displacement of this fracture, so that when we are treating, we treat them accordingly. So some of the classical features of this condition is that there's transverse radial fracture. When we say transverse, means the fracture occurs alongside the forearm. So this tile that is away from the elbow, close to the wrist, and then it occurs along. Okay, and then there could also be radial shortening. So you could see that the bone here, that is the radius, the one close to the thumb, becomes shortened as compared to the left hand or the right hand, which is unaffected. There could also be comminution, that is small breaks in the bones around the region. There could also be an ulnar styloid process fracture. That's it, around this side also there could be fracture around the ulnar bone. So how do you differentiate other conditions from this condition called Colles fracture? We have a condition also called a scapholinate ligament tear, that is affecting the wrist. Wrist. So when we see that there's injury to the wrist and then not to the forearm bone, then it means it's not really Colles fracture. We also have median nerve injury. So we have other diagnoses that we can go to differentiate between that. We also have triangular fibrocartilage complex. So many injuries that we could rule out to be able to diagnose this condition called ulnar, called Colles fracture. So we have some outcome measures that we can be able to use to see the daily progress of this condition. We have the DASH, that is the disability of the arm, shoulder, and then the hand. So we can see the improvement of the condition as treatment is going on. We also have the green score. We have the O'Brien scores. These are physical therapy outcome measures that, as treatment is going on by the physical therapist, we can see the level of improvement. So the condition actually depends on the person's age. That is the severity of the condition. That how severe the condition will depend on the person's age, the level of activity of the patient, then the age of the patient. So these two are very important: the level of activity and the age of the patient. And then treatment also depends on the surgical preference. So if the patient wants to go too conservative, the medical doctor, the surgeon advises the effect of doing that, and then it's carried out. Okay, so how do you treat this condition as Colles fracture or broken wrist? First of all, we, depending on how severe it is, if it's not so broken, the bones are not so broken around the wrist region, we go to conservative method, that is without surgery. So the main aim is actually to reduce the swelling, that is reduce the swelling and reduce the pain, take away the pain, and also stabilize the wrist region, the whole wrist to the forearm, so that allow the bones to be able to heal on their own, because that's how natural phenomenon takes place. If the bones are further splitted, we go to surgical means. We have one we called open reduction and then internal fixation, or open reduction and external fixation. The first one occurs when there is less displacement of the bone, that is, the bones don't shift too much. But when the bones shift, sometimes they come out of the wrist, we go through the open reduction, external fixation, that is, the metals come out to protect the bones from further causing harm. So these are some of the surgical procedures that we go through. Aside that, the physical therapist, after about 6 to 8 weeks, the physical therapist also goes through various protocols to be able to relax the wrist and return the wrist to function. So we give the patient a volar forearm splint, that is, it goes around the arm and it keep the arm in this position so that there will be very good healing of the bone. And then further on we start treatment. Okay, so when there's swelling, the first instance is to use ice. So we use an ice block, or we call the system we call cryotherapy, to reduce the swelling and the pain. Then we do gentle massage around the wrist and then the forearm to allow the blood to flow and then allow the swelling to come down. So the ice therapy, that is the using of the ice block, is actually about 10 to 15 minutes around. So they move the ice block around the wrist, around the palm region, and this helps to reduce the swelling. This ice is very, very important. When we have an open wound, we don't use ice block, and when the wound is not opened, then we use an ice block. Some of the contraindication, that is what, when we don't use ice block, is when we have an open wound. We have a condition we call Raynaud's disease, that is, we have the fingers becoming bluish in color, so we don't use ice block. Aside that, when the swelling comes down, we use a device we call TENS, transcutaneous electrical nerve stimulation. This is an electrical stimulation that helps to relieve pain and improves activity of the wrist and then return to function. Aside that, we go to gentle exercises to return the wrist function. So we move the wrist in and out. We do some grip strength exercises. We have something we call a ball, that is, we put in the hands to be able to improve the grip strength, because initially the patient with this condition cannot hold things. So we want to restore the function after we've noticed that the bone has healed after 6 to 8 weeks. So 8 weeks onwards, or even sometimes 7 weeks onward, we start gentle activity and exercises to restore the patient's hand to function. So aside that, also we ensure that the patient eats well, eats a lot of calcium food, so that the bone can heal well as before therapy begins. Okay, so let's look at some pictures. I'm sure that we will be able to appreciate this condition very well when, yes, okay, so just a minute. Okay, so you can see the picture here. Yes, the Colles fracture. You can see the bone here broken. You can see separated, totally separated. Yes, okay. I think this one is a bit blurred. So this is the bone, actually the bone of the wrist. You can see, so you can see it here. So this is the radius, the one close to the thumb, as we mentioned earlier on, is called the radius. So the bone closer to the thumb is called the radius, and the one closer to the small finger is called the ulna. And we could have instances where both the radius and the ulna are broken, and this could also be referred to as Colles fracture. So we can see it here. So the impact is on the radius now. You can see it from an X-ray. This is an X-ray. Okay. So we can see this is called the volar splint, and this helps to keep the wrist in a very good position for the bones to heal very, very, very well. Okay, so you can see another one here, the volar splint. So this is the broken bone. This is an X-ray showing the broken bone. It's very visible here. Okay, so you see the impact here. So you see goes here and the bone breaks, and this is referred to as Colles fracture. You can see the person here, the impact here goes straight down into the floor. Okay, so this is the anatomy of the hand. This is the ulna. The ulna is always close to the small finger, and the radius is always close to the thumb. Okay, so this is also anatomy, more detailed information given here. This is an X-ray of the hand. Okay, this is a very detailed anatomy of the condition here. You can see it the phalanges, as I mentioned, the first seconds, a few seconds, phalanges, the metacarpals. These are metacarpals, these are carpals, these are the radius, and this is the ulna. Okay, so I'm sure that we have a very fair idea of this condition, how it's being treated. Yes, and okay. You can see some of the pictures here. All right. Okay, so this discussion has been very short though, but I'm sure we've learned a lot from this condition called Colles fracture, or Colles fracture, or we call it broken wrist, Colles fracture, or broken wrist. Thank you very much for your time. If you have any questions, any suggestions, yes, you are welcome. Yes, you're welcome. Okay. Any question? We talk about broken wrist or Colles fracture. Yes. Any question? Okay. So without any further questions, so many people join the line in and out, but I'm sure that after this we can share the videos to various friends and loved ones. Yes, and we learn a lot. Okay, I see some people joining in again, some other joining. Okay, thank you very much for your time. So our next topic is also very interesting, and I will entreat you to share us the flyers and then the links to various contacts. Yes, our next topic is called knock knees. Yes, so this is not bow leg, this is called knock knees. So we'll be talking about this the next time. So just let's keep our fingers crossed. And then next week's topic is called knock knees or genu valgus. Okay, thank you very much for your time. And I'm very, very appreciated. May the Lord be with us all. Have a blessed week. May the Lord take good care of us and be safe. Take care. Bye.